Good evening, everyone, and welcome to this session of the Environmental Tract, the Child Environmental Tract. My name is Evelyne Ng'ang'a, and I'll be taking you through early environmental exposures and immune dysregulation. So as an outline, I'll just do a brief introduction and look at the immune system during early life, the different environmental exposures and their effects, and conclusion. I know the title specifically outlines the immune dysregulation, but I just thought more to look into immune modulation because part of it is the dysregulation. Right. So as an introduction, so we know that human health is a product of both genetics and the environment, a premise that also holds true for the immune system. And although our genetic makeup is essentially set at birth, the environment that we experience is constantly changing, presenting novel challenges in the development and function of immunity. So if we compare, for instance, our grandparents, great-grandparents, environment in which they were born is very different from where we find ourselves today. And as much as we do acquire some of their genetic makeup down the, in the generations, there's a lot that changes with regards to how we manage, how our immune system develops. Exposure to environmental contaminants can produce profound effects on the immune system. And some of those effects are seen early in life or sometimes may only be seen in adulthood. So specifically the immune system during early life. So this is where a baby has been born. So you have a neonate up until about 2 years, because that's when most of the mutation takes place of some of the cells of the immune system. You'll notice that there tends to be lack of acquired immune memory, and there lacks differential regulatory responses. So just as a reminder, the immune system has the innate arm and also the adaptive arm. And that's what we're referring to here. And there's also immunological priming that tends to be altered at this stage of life. There's a fine balance that has to take place. So this immune system at this stage is trying to defend against infection, but at the same time, minimize potentially harmful inflammation that may be occurring, and at the same time, mitigate colonization by microbes as it develops and transitions from the relatively protected womb to the external world. And you notice that the CD4 T cell responses are slower to develop and have a predisposition to a T helper 2 or the T helper 17 responses against extracellular pathogens. T helper 1 responses are important for defense against intracellular pathogens and cell-mediated immunity, and they only reach adult levels after about 2 years of age. Now, programming early in life represents not only a window of vulnerability for long-term prevention of infectious diseases and maintenance of homeostasis and health. This window of opportunities is what we'd like to, target or try to make possible for our infants so they have a better life ahead. So in terms of the various routes of entry of these environmental exposures, it can either be through inhalation, ingestion, dermal, intravenous, intraarterial, and also in utero for those who, from the beginning, during pregnancy. And so some of the effects of these environmental toxicants are grouped into two. So you can either have immune activation, whereby you have desirable or undesirable effects. So the desirable effects would be things like vaccines or the anti-tumor effects. Undesirable effects would be inflammation, anaphylaxis, or hypersensitivity. Then you also have immune suppression, where you have also the desirable versus the undesirable. So the desirable here, we're talking of treatment of inflammatory disorders, prevention of allergic responses, and transplant acceptance. Undesirable effects here would be things like reduced response to infection and cancer, and myelosuppression and thymic dysfunction. So you see, we have the pros and cons when it comes to what we are exposed to in our environment. There are desirable effects versus undesirable effects, and what we want to avoid are the undesirable effects. So there is a hypothesis by the name the developmental origins of health and disease, which posits that presentation of adult disease can be traced back to childhood, perinatal, or in utero exposures. And a study done found in the US actually found that there were 232 toxic chemicals in the umbilical cord from newborn babies in the US. And that some of these chemicals, including the DDT, DDE, PCBs, and PBDEs, were passed to babies through breast milk. So you can see these exposures can start very early. So right from the beginning, from pregnancy, all the way even to the perinatal period. And some of these immunotoxins include heavy metals, things like mercury, cadmium, lead, arsenic, which have been shown to cross the placenta and as such get to the baby and actually cause some immunomodulation. Tobacco smoke, synthetic compounds such as the tetrachlorodibenzo-dioxins, whose major source is waste incineration. So where there are incinerators, you see that very dark smoke that you see coming out of those chimneys, quite a major source of an immunotoxin. Perfluorinate compounds, the PFCs. So these are quite commonly found in things like Teflon and non-stick cookware, which we love so much, but we need to be quite aware, especially when it starts to degrade or come off. We have the grease repellent coating. So these are those coatings that I used to say wrap sandwiches or burgers for our fast foods. They could actually contain these PFCs that can then be transferred into the food. Dental floss, personal care products like nail polish, eye makeup, etc. Polychlorinated biphenyls. These have been found to be capable of crossing the placenta, the latter two having been detected in breast milk as well. Now, maternal infection, this does impact the neonate immune programming. So when a mother is pregnant and either gets a UTI or an acute gastrointestinal infection, or even during this period of the pandemic, COVID, all these infections do have an impact on the immune system. And the effects can be specific to that particular infectious agent. So for instance, in the case of COVID, or the effects could result in a general modulation of the host's immune system. Can end up with a hyperreactivity or hypersensitivity of the immune system. And some are even saying that over time you could end up with an autoimmune kind of disorder. So you can see all these things are working to modulate the host immune system. Exposure to helminths in utero can result in specific and non-specific immune programming, changing the risk of perinatal infections and vaccine responses. And studies have actually been done to show that various places will have, children will respond differently to different vaccines, just based on their environment. Exposed and infected children, they tend to have altered innate cytokine responses early in life. And this is in comparison to the non-HIV exposed children. When it comes to breastfeeding, especially now that we are celebrating the breastfeeding week, we see that breast milk contains quite a variety of very nutritious components. So things like proteins, which aid in digestion, beta-casein, lactoferrin. Lactoferrin is known to facilitate uptake of iron and also stimulates the gut to produce some cytokines. Then we have lysozymes, which help to degrade the cell wall of gram-positive bacteria. And kappa-casein, which blocks pathogen binding to gastric mucosa. We have soluble and cell-secreted cytokines, such as the interleukin-1 beta, interleukin-6, interleukin-8, interleukin-10, tumor necrosis factor alpha, the GM-CSF. So all of these help and work towards the immune system to fight off infection. Then we also have colostrum, which has neutrophils, B and T cells, all these being cell immune system that help fight. Taking to a Mediterranean diet, which here represents fish, fruits, vegetables, legumes, nuts, and cereals, during the perinatal period has been found to be protective against wheeze and atopy in children, while the detrimental components such as red meat, margarine, and junk food intake have been shown to cause the reverse or the opposite. And neonatal immune programming can take place in utero, given that food and environment antigen-specific T cell responses are detectable in virtually all neonatal cord blood samples. So in addition, nutrition may be the source of antigens to which the immune system must become tolerant. And we know, especially like during the period of weaning, this is where tolerance is acquired, and the best window period is usually the 4 to 11 months. And additionally, the nutrition provides factors that themselves modulate immune activity. Now, what's interesting is that micronutrient deficiencies are plausible modulators of immunity. So for instance, children who may have zinc deficiency or vitamin A deficiency, but this has been found to be transient in that subsequent supplementation can rescue the immune system functionality. So for instance, zinc we know deals with the deficiency would result in impaired growth and immune cell function. Vitamin A is quite important for the integrity of barriers, lymphocyte proliferation, and cytotoxic T cell activity. And so we must be quite careful when it comes to assessing our children for these deficiencies. Then there's transient exposures to starvation, which has been shown to have intergenerational implications for metabolism, and by proxy, the immune status. And this was actually seen in 2 studies done in Sweden and in Holland during the World War II, when people faced quite a bit of, there was an acute perinatal famine. And the changes in the immune system at that stage have been found to be passed down intergenerationally. When it comes to the hygiene hypothesis and microbial exposure, maternal involvement in microbial colonization may be from in utero exposure, during childbirth, or even transmission through breast milk. And there's ample evidence which suggests that the womb and the developing fetus are actually not sterile. And as a result, it may be the case that neonatal tolerance to certain microbes may actually begin before birth. And clinical evidence that bacteria may invade the uterus from the abdominal cavity, blood, or the cervix does exist. While the womb may not be sterile and be the stage for limited in utero microbial exposures, the vast majority and continued interaction with microbes takes place postpartum. Then there's the issue of type of delivery, so cesarean section versus vaginal delivery. We know those who undergo vaginal delivery, the babies get to be coated with quite a bit of the microbiome along the vaginal canal in comparison to babies born via CS. And as a result, they're seen to manage infection better and even have less dysregulation, such as allergies later in life. Now, postpartum, neonatal gut microbiome composition is likely to continually be influenced by breast milk. Now, the microbiota and immunity, the human gut microbiome is acquired from local environments, and this tends to vary geographically. And the variation also includes diet and lifestyle. So those who have foods that are rich in probiotics or prebiotics versus those who are deficient of the same, you'll find that their microbiomes are very different. And of course, lifestyle. So for instance, alcohol consumption versus non-alcohol consumption, exposure to farm animals versus non-exposure to farm animals. All this contribute to the human gut microbiome. And it's been found that early life microbial exposures may be exceedingly important within the context of trained innate immunity. Innate immune cells can be trained by prior exposures and can influence the success of vaccines. So this has been really emphasized in the studies that have been coming across, that in addition to just immunomodulation, when you're looking for the desirable effects of vaccines, those can actually be altered, and that can vary from population to population. And so as I come to the conclusion of this talk, I only had a very short time to be able to just capture all these things. What we are seeing here is that in order to promote immune-mediated health for life, we must consider the importance of environmental exposures for immune programming and learn how to direct the developing immune system to optimize health outcomes. Insights into the mechanisms underlying immune programming in early life presents us with the unprecedented opportunity to become stewards of not only prevention of disease, but also promotion of lifelong health. And so it's my hope that after this talk, we can see what kind of advice to give our pregnant moms, our parents when they bring their children to hospital, those children who seem to have recurrent infections or have some form of immunodysregulation, so inflammatory disorders, allergies, help them understand better what the environment also has to do with the child's immune functioning. And we hope that in the future we'll have a healthier population. Thank you very much. Enjoy the rest of the symposium.